Let's discuss the 5 transporting points. Yin spring points, stomach 44, inner quad. Location between the second and third toes proximal to the interdigital fold. How to find? Locate stomach 44 just proximal to the interdigital fold between the second and third toes. Needling 0.5 to 1 tune vertically or obliquely in a proximal direction. Actions, indications, opens the channel, expels wind, and clears heat, alleviates pain, regulates the intestine, clears damp heat, pumps the shell. Special features being spring point, water point, mud and yang heavenly star point, major point for clearing heat at the head and face. This is a very important point of the stomach channel. First of all, it clears heat from the stomach channel and can be used for bleeding gums and any stomach complaint with heat. It is mostly used for excess patterns. In the context of diseases from interior pathogenic factors, it is used in fibrin diseases at the bright young stage of the 6 channels or the chi level of the 4 levels. Along the stomach channel, particularly the lower jaw. Often combined with LI4, it eliminates wind from the face and is therefore used in facial paralysis and trigeminal neuralgia. Important point for to clear stomach heat used in fibrin diseases at the bright young stage of the 6 channel or the chi level of the 4 levels to clear stomach heat. Effective to stop pain along the stomach channel, particularly the lower jaw. Often combined with LI4, it eliminates the wind from the face and is therefore used in facial paralysis and trigeminal neuralgia. Stomach 44, the yin spring and water point of the stomach channel was included by Madan Yang, the great physician of the Jin dynasty, among his 11 heavenly star points. This grouping is the most vital acupuncture points of the human body. According to the classic difficulties, yin spring points are indicated for heat in the body. As a distal point, the principal action of stomach 44 is to clear heat and fire from the stomach channel, most especially its upper portion. It is a primary point in the treatment of many heat disorder of the head and face, such as toothache, pain of the face or eye, nosebleed, throat painful obstruction, etc. This frequently combined for this purpose with LI4. In the treatment of toothache, some sources recommend the use of stomach 44 for the lower jaw and LI4 for the upper jaw. While others consider stomach 44 equally adept at treating both the upper and lower jaw, this is borne out by the pathway in the stomach primary channel, which descends from the eye region to enter the upper gum, joins the governing vessel at U26, then circles around the lips and descends to meet the conception vessel at REN 24. Pain of the face almost invariably involves disorder of the stomach channel, and stomach 44 is an essential point in the treatment of disorders such as trigeminal neuralgia, often in combination with local points such as stomach 4, stomach 6, stomach 7. The stomach channel also makes various connections with the throat and nose. The primary channel descends alongside the throat. The loop connecting channel terminates at the throat. The primary channel originates at LI20 and ascends to the root of the nose, and the divergent channel passes alongside the nose. Both throat painful obstruction and nosebleed can be due to heat accumulating in the yang channel. In the latter case, causing reckless movement of the blood. The second important action of stomach 44 is to harmonize the intestine and clear dampness and heat. And it is indicated in the treatment of such disorder as diarrhea, dysenteric disorder, blood in the stools, constipation, and abdominal pain. One special condition for which stomach 44 is indicated is the symptom of hands and feet counterflow cold, where only the hands and feet are cold but the body is warm. This may occur in the pattern known as true heat, false cold, where heat constraint in the interior prevents the yang qi from circulating to the limbs, despite the apparent cold and other symptoms, as well as the pulse and the tongue, are indicative of heat and constraint. These conditions must be differentiated from cold collapse, cold inversion, where either the whole limb or the areas distal to the elbows and knees are cold. Finally, like many points of the stomach channel, stomach 44 has an action on calming the spirit. It is particularly suited to the treatment of depressive type disorders and is indicated for aversion to the sound of people talking and a desire for silence. Thank you for your attention.
Let's now discuss kidney 3, a shoestring point. Kidney 3 is located in the depression between the highest prominence of the medial malleolus and the Achilles tendon. How to find? Locate the highest prominence of the medial malleolus. From there, palpate horizontally towards the Achilles tendon. Kidney 3 is located in a depression that can be palpated anterior to the tendon. Needling vertically 0.3 to 1 zoom. Actions or indications. Kidney 3 nourishes kidney yin and clears deficiency heat. Tonifies kidney yang, stabilizes the kidney qi and the lungs, helping the kidneys absorb the qi. Regulates menstruation. Strengthens lower back, local point. Special features, Yuan-source point, shoestring point, earth point. Important point for tonifying the kidneys, especially kidney yin. The kidneys occupy a unique position among the Zangfu, both storing the yin essence and conserving and controlling the Mingmen fire. Kidneys are thus the root of the yin and yang of the whole body. Because of this fundamental role, deficiency of the kidneys may both cause and result from disharmony of any of the other Zangfu. The spiritual pivot in chapter 6 recommends the use of the shoestring points in the treatment of disorders of the Zang, while in chapter 1, it says when the 5 Zang are diseased, select from the 12 Yuan-source points. Kidney 3, the shoestring and Yuan-source point, is therefore the principal point in the kidney channel to treat disharmony of the kidney Zang, which, due to the unique nature of the kidneys, always involves deficiency, principally of kidney yin or kidney yang. Kidney yin deficiency may affect the kidneys alone or by failing to nourish the liver, heart, or lung, all of which are reached by the kidney channel, affect the Zang also. Yin deficiency may manifest in 2 main ways: failure to nourish and moisten, or failure to restrain fire. The art of treating yin deficiency lies in carefully assessing the relative importance of these 2 aspects and placing appropriate emphasis on nourishing yin and cooling fire. Kidney 3 is the foremost point to treat yin deficiency, affecting those areas of the body either reached by the kidney channel or dominated by the kidneys, specifically the throat, intestines, brain, teeth, and ears. The kidney primary channel ascends to the throat, and if heat from deficiency scorches and dries this region, there may be chronic low-grade sore throat, which is typically worse with tiredness at the end of the day and at night. The kidneys dominate the 2 lower yin, anus and urethra. And if deficient fluids and deficiency heat desiccate the intestines, there will be difficult defecation, illustrated by Wu Chu-tong's graphic image in the systematic differentiation of worm diseases. When the fluids are deficient, there is not enough water to make the boat move. The spiritual pivot states, the brain is the sea of marrow. Kidney essence produces marrow to fill the brain and spinal cord. And in cases where the sea of marrow is deficient, there will be headache and the dizziness. According to a saying of Chinese medicine, the teeth are the surplus of the bones. If the kidneys fail to nourish the teeth and heat from deficiency rises to this area, there will be chronic toothache accompanied by looseness of the teeth. The spiritual pivot says, kidney chi opens into the ears. When the kidney is in harmony, the ears can hear the 5 sounds. Deficiency of the kidneys, therefore, can result in tinnitus and deafness. In all these cases, kidney 3 is the primary point to tonify and nourish the kidneys. The intimate relationship between the kidney yin and liver yin and the kidney essence and liver blood is emphasized in the saying, the kidneys and the liver share the same origin, and the statement in comprehensive medicine according to Master Zhang, when the essence is not discharged, it will return to the liver and transform into clear blood. Kidney 3 is commonly used in prescriptions to treat kidney-liver disharmony, whether due to failure of water to nourish wood or to injury to the kidneys from prolonged liver disease, giving rise to headache, dizziness, tinnitus, and deafness. The kidneys pertain to water and the heart to fire, and both belong to Shao Yin. The heart stores the spirit, and the kidneys store the will. When the kidneys and the heart function harmoniously, heart fire and kidney water, the spirit and the will mutually support each other. When the kidneys and the heart lose harmony, heart yang is unable to descend to warm the kidneys, and kidney yin is unable to nourish heart yin and restrain heart fire. This loss of contact between water and fire disturbs the spirit and gives rise to insomnia, excessive dreaming, and poor memory, usually of the severe and chronic kind. Kidney 3 is an important point to bolster the kidneys, enable them to support the heart. The lung is the canopy and the kidneys are the root. The lung descends qi and fluids to the kidneys below. The kidneys anchor the qi and steam the fluids to moisten the lung above. Kidney-lung disharmony commonly manifests in 2 main ways. Kidney yin deficiency fails to moisten and cool the lung, giving rise to wheezing, dry cough, and blood-streaked sputum. And the kidneys fail to receive and anchor the qi from the lung, giving rise to dyspnea, coughing, and asthma. Kidney 3 is indicated in both these patterns of excess above and deficiency below, and was specifically recommended by Sun Si Miao in the supplement to the 1,000 ducat formulas for kidney cough. Although subdivided into kidney yin and kidney yang, the kidneys are of course one zang, even though in clinical practice, deficiency of either yin or yang will usually predominate. When one aspect of the kidneys is deficient, it is frequently the case that the other will also become deficient. This is clearly spelled out both by the essential questions, which states, injury to yin will reach the yang, injury to yang will reach the yin, and by the essential readings in medicine, which says, without yang, yin cannot engender, without yin, yang cannot transform. It is a long-standing principle of tonifying the kidneys that in kidney yang deficiency, one should also nourish kidney yin, and that in nourishing kidney yin, one should also pay attention to the kidney yang. Thus, the essential question says, for yang diseases, treat the yin, for yin diseases, treat the yang. And Jianqian echoes this in his statement, nourishing yin to help yang is a skillful way to strengthen yang. For this reason, almost all acupuncture points that tonify the kidneys will benefit both kidney yin and kidney yang. Kidney 3, the principal point on the kidney channel to tonify the kidneys, exemplifies this principle. When kidney yang fails to warm the body and transform fluids, there may be coldness of the lower limbs, backache, and urinary symptoms such as frequent and copious urination and incontinence. The close relationship between the kidneys and the libido and sexual function is underscored by the application of kidney 3 in the treatment of impotence, seminal emission, and sexual taxation, which is depletion and exhaustion due to excessive sexual activity. According to the essential questions, the kidneys dominate hibernation and are the root of sealed storage and the residence of essence. Their residence manifests in the hair and fills the bones. The kidney primary, luo connecting, and sinew channels all ascend through the spine, and any pattern of kidney deficiency may lead to malnourishment of the sinews, muscles, and bones, especially in the lumbar region, the residence of the kidneys. Kidney 3 has long been used for the treatment of kidney deficiency lumbar pain and is also indicated for heel pain, which may be due to kidney deficiency, traumatic injury, or painful obstruction. In the treatment of heel pain, kidney 3 should be needled to obtain sensation radiating strongly to the heel region. The penetrating and conception vessels are both nourished by and have their root in the kidneys. And the essential question says, the vessel of the uterus connects with the kidneys. Kidney 3 may be used when kidney deficiency leads to disharmony of these extraordinary vessels, resulting in irregular menstruation. Although it is interesting to note that this is a modern indication and that no gynecological indications or combinations appear in any major classical texts. Finally, kidney 3 is cited in the Song of the Nine Needles for returning the yang for the treatment of collapse of yang characterized by loss of consciousness, aversion to cold, cold counterflow of the limbs, purple lips, etc. Thank you for your attention.
Let's discuss the extra point, the Shiquizhuixia, below the seventh vertebra, and Jianqian, the front of the shoulder. EXV8 location on the midline below the stimulus process of the fifth lumbar vertebra, L5. How to find? Locate the top ears line and L4. Next, palpate in an inferior direction to the next vertebra, L5, and locate EXV8 below the border of its stimulus process at the lumbar joint, lumbosacral joint. Located in the same level are point of EXV2 bladder 26.5, 1.5 June lateral to the midline. Needling 0.5 to 1 June vertically to the skin or obliquely in an inferior direction. The patient's back should be straight or slightly flexed to avoid a spinal puncture. Oblique insertion in a superior direction should only be carried out by experienced practitioners, as in small persons, regardless of their weight. Spinal canal can be reached after only 1.25 June. Caution, in pregnant women about to go into labor, this point might have a labor-promoting effects. Action indication, it tonifies the kidney, opens the channel locally. Location, this point is located on the midline of the back below the tip of the fifth lumbar vertebra. Actions removes obstruction from the channel, benefits the lower back. So we have here the illustration, bladder 23, jingle, and the bladder 26 location. Indications, chronic or acute lower back ache. This point is excellent as a local point for the treatment of chronic or acute lower back ache, whether the ache is on the midline or bilateral. It is only used if the ache is quite low down on the sacrum or just above it. It is usually combined, this point with bladder 26. This point is superior to DO3 or DO4 for the treatment of lower back ache. It removes obstruction from the channel, benefits the lower back, chronic or acute lower back ache. Combinations, chronic lumbar pain, bladder 26, bladder 53, and bladder 40. And BW25 was first mentioned in the supplement to the 1,000 Ducat formulas. It is among the most commonly used points for chronic back pain and is very often found to be the focus of tenderness. It may be used in both deficiency and excess patterns, and in frequently encountered clinical situations where the two are found in combinations. Next, the front of the shoulder, the EX upper extremity location on the midpoint of a line connecting the end of the anterior axillary fold and LI15, the Jianqian. How to find? Locate LI15 as the patient to actively abduct their arm and locate LI15 in the depression anterior and inferior to the acromion. Ventrolateral extremity of the acromion. The end of the anterior axillary fold is formed by the easily palpable lower border of the pectoralis major muscle. Jianqian is located on the anterior aspect of the shoulder joint, midway between these two reference points, leading vertically up to 1.5 chin. Action indication, it opens the channel and the luo vessels locally. Location, midway between the end of the anterior axillary fold and LI15. Action removes obstruction from the channel, spells dampness and cold. So we have here the illustration, the Jianneiling, KI3. Indications, stiffness and pain of the shoulder, difficulty in abducting the arm, feeling of heaviness of the arm, numbness. This is an extremely useful local point for the treatment of shoulder pain or frozen shoulder. Is selected when the pain radiates towards the anterior aspect of the shoulder, lung channel. This point is called as Jianqian, front of the shoulder. Removes the obstruction from the channel, expels dampness and cold, stiffness and pain of the shoulder, difficulty in adducting the arm, feeling of heaviness of the arm, numbness. Jianqian, also known as Jianneiling, inner mount of the shoulder is frequently palpated and needle if tender for pain in the front portion of the shoulder joint. In clinical practice, it is commonly combined with the other important points for treating the shoulder such as LI15, LI16, Sanjiao 14, SI10. Thank you for your attention.
Let's now discuss spleen 5, a Jing River point. Spleen 5 is located in the depression at the junction of a vertical line drawn along the anterior border and a horizontal line drawn along the lower border of the medial malleolus, or in the depression halfway between the highest prominence of the medial malleolus and the tubercle of the navicular bone. How to find? Spleen 5 is located in a depression anterior and inferior to the medial malleolus at the junction of a vertical line drawn along the anterior border and a horizontal line drawn along the inferior border of the medial malleolus. Spleen 5 is located distal to the tendon of the tibialis anterior muscle. Located in a comparable position on the lateral aspect of the foot is GB40. In a depression at the junction of a vertical line drawn along the anterior border and a horizontal line drawn along the inferior border of the lateral malleolus. Needling 0.3 to 0.6 tune vertically, obliquely, or transversely, or subcutaneously deep to the tendons towards stomach 41. Actions, indications. Spleen 5 tonifies the spleen, eliminates dampness, benefits tendons and bones, moves qi locally, calms the shen. Special features, Jing River point, metal point, sedation point, important point for treating damp P syndrome. Spleen 5 is an important point for sinews and joints. Being the river point, it is the point where qi of the channel is diverted to bones and joints. This point is in fact very much used for chronic painful obstruction syndrome from dampness of the knee or ankle. In fact, it can also be used as a general river point for every channel's painful obstruction syndrome from dampness. It is an important point to affect all sinews and joints in painful obstruction syndrome, strengthen spleen in spleen deficiency, tiredness, lassitude, desire to lie down, regulates intestines, calms the mind, and opens the mind's orifices. The term shang in this point's name refers to the note associated with metal in the theory of 5-phase correspondences, and spleen 5 is the metal and Jing River point of the spleen channel. According to 5-phase theory, therefore, it is the child point of the spleen earth channel, suitable for reducing excess conditions. The illustrated classic of acupuncture points on the bronze man says, when the spleen is excess, reduce spleen 5. The spleen, dominating the ceaseless yang functions of transportation and transformation, easily becomes deficient in qi and yang, and therefore, most of its patterns of disharmony involve deficiency. There are two meanings, however, to the pattern of spleen excess in relation to the actions of spleen 5. Firstly, if exterior pathogenic dampness or damp heat attack the body, they may disrupt the function of the middle jaw, giving rise to acute onset of symptoms such as chills and fever, with vomiting, abdominal pain, diarrhea, coughing, and diarrhea in children, with loss of appetite, heaviness of the body, and lethargy. Secondly, deficiency of spleen qi and yang may lead to excess of yin in the form of accumulation of interior dampness, giving rise to chronic lethargy, indolence, somnolence, swelling of the face, diarrhea, and digestive difficulty. In both cases, there will be a thick and greasy tongue coating and a slippery pulse, indicating an excess pattern. Like many points of the spleen channel, for example, spleen 3, spleen 5 is able to address both deficient and excess aspects of spleen disharmony. According to the spiritual pivot, when the disease is at the yin within yang, the sinews and bones needle the Jing River points of the yin channels. Spleen 5, the Jing River point of the spleen channel, is an important point in the treatment of disorders of the sinews, muscles, and bones due to invasion and retention of pathogenic dampness. Damp painful obstruction, also known as fixed painful obstruction, is characterized by stiffness, swelling, and heaviness of the joints, and a tendency to worsen during humid weather. Since spleen deficiency may predispose to or result from damp painful obstruction, points of the spleen channel such as spleen 5, which both tonify the spleen and resolve dampness, are most often employed in the treatment of damp painful obstruction anywhere in the body in combination with local points. Spleen 5 is also mentioned in various classics for the treatment of bone painful obstruction, the development of painful obstruction where deformity of the joints occurs. Spleen 5 is, of course, especially effective in treating disorders of the ankle joint and its surrounding soft tissue, whether due to painful obstruction or traumatic injury. In such disorders, the needle may be directed to join with stomach 41 at the anterior of the ankle joint. According to the spiritual pivot, when the disease manifests itself in the voice, the Jing River point should be selected. Both the spleen primary and divergent channels give rise to the tongue, and spleen 5 is indicated for stiffness and pain at the root of the tongue, as well as for impaired speech. The spleen channel links with the heart, and like several other points of the channel, spleen 5 has many indications for disturbance of the spirit. For example, mania, depression, agitation, melancholia, propensity to laughter, nightmares, etc. This can be explained by the ability of spleen 5 both to tonify the spleen and to clear dampness. If spleen qi is deficient, the source of blood will be weak and the heart and spirit will lack nourishment. Alternatively, when dampness accumulates and transforms into phlegm, it may be carried upwards to obstruct the heart and cloud the spirit. Whilst if phlegm transforms to phlegm heat, there will be agitation of the spirit. The spiritual pivot says, the spleen stores the nutritive qi. Nutritive qi is the residence of thought, whilst the systematic classic of acupuncture and Moxie Bastion says, thought has its origins in the spleen, but takes shape in the heart. Spleen 5 is one of the few points indicated for excessive thinking, the mental activity which both results from spleen disharmony and leads to injury of the spleen. Thank you for your attention.
Let's discuss the stomach channel points overview. Specific points according to their function. Yuan-source point, stomach 42. Luhu connecting point, stomach 40. C-cleft point, stomach 34. Associated back shoe point, bladder 21. Associated front boob point, REM 12. 5 shoe transporting points, Jingwell point, metal, sedation point, stomach 45. Jing spring point, water, stomach 44. Shoe stream point, wood, stomach 43. Jing river point, fire, purification point, stomach 41. SE point, earth, stomach 36. V meeting point, opening point, lower SC point, of the stomach, stomach 36, of the large intestine, stomach 37, of the small intestine, stomach 39. Meeting points with the Renmai, Yangqiao, the Yangqiao-mai stomach 2, with the Yangqiao-mai stomach 3. With the primary LI channel, Yangqiao-mai, Dumai, Renmai, stomach 4. With the gallbladder channel, stomach 5, stomach 6. With the gallbladder channel, stomach 7, stomach 9. With the gallbladder channel, Yang V Mai, stomach 8. With the primary LI, SI, TB, GB channels, stomach 12. With the Chongmai GB channel, stomach 30. Other channels with the stomach channel, LI20, bladder 1, GB3, GB4, GB5, GB6, do 14, do 24, do 26, do 28, REN 10, REN 12, REN 13, REN 24, GB 14, GB 21. Gawu command point for the abdomen, stomach 36, window of heaven point, stomach 9, point of the 4 C's, C of chi point, stomach 9, C of brain, stomach 30, stomach 36, C of blood, stomach 37, stomach 39. Madanyang heavenly star point, stomach 36, stomach 44. Sun Sima ghost point, stomach 6. Other functional points, front move point of the large intestine, stomach 25. Most important, acupuncture, plug point, stomach 40. Points according to the region, local points, eyes, stomach 1, mouth and teeth, stomach 4, stomach 6, jaw, stomach 7, large intestine, stomach 25, small intestine and bladder, stomach 28, urogenital region, stomach 30, knee, stomach 34, stomach 35, stomach 36, foot, stomach 41. Adjacent points, forehead, stomach 8, eyes, stomach 2, mouth and teeth, stomach 7, throat, stomach 10, spleen, stomach, gallbladder, stomach 21, kidney, stomach 29, abdominal region, stomach 25, stomach 26, stomach 30, foot, stomach 34, stomach 36, toes, stomach 41. Distal points, frontal headache, stomach 44, nose, stomach 44, mouth and teeth, stomach 44, throat, stomach 44, shoulder region, stomach 38, lungs, stomach 40, spleen, stomach 36, large intestine, stomach 37, small intestine, stomach 39, epigastrium, stomach 36, shoulder, stomach 36, stomach 38. Thank you for your attention.
Let's now discuss location methods and tune measurements for the thoracic spine. A slightly kyphotic position can help with palpation and point location on the thoracic spine. Approximately from the midpoint of the thoracic spine downward, palpation can become difficult if the patient is seated or standing, so that a prone position is recommended here. Placing a pillow under the patient's abdomen can further help to widen the spaces between the spinous processes for better palpation, especially in patients with hyperlordosis of the lumbar spine. Thoracic vertebrae. After identification of C6 and C7, the lower cervical spine, the thoracic vertebrae can be counted from there, beginning with T1. Points on the bladder channel and the dumai at the level of the thoracic spine. The scapula is also a helpful reference point for orientation on the thoracic spine. The patient should be seated or standing with his arms loosely hanging down. The medial aspect of the scapular spine is approximately level with the spinous process of T3. The inferior angle of the scapula is approximately level with T7. Lower thoracic spine. The vertebrae of the lower thoracic spine are best located from the lumbar spine. 12th rib. The 12th rib marks the lower border of the posterior aspect of the thorax. By palpating its course from a medial in a lateral direction, its free end will be reached on the lateral aspect of the back where gallbladder 25 is located. Thank you for listening.
Let's discuss the window of heaven points, SI17, heavenly appearance. Location, posterior to the mandibular angle on the anterior border of the sternocleidomastoid muscle. How to find by rotating the patient's head in the opposite direction, the border of the sternocleidomastoid muscle becomes more pronounced. SI17 is located halfway between the angle of the mandible and anterior border of the sternocleidomastoid muscle. Needling vertically 0.5 to 1 tune. Caution, internal carotid artery, internal and external jugular veins. Actions, indications, expel wind, opens the channel, disperses accumulations, benefit the ears and throat. Special features, window of heaven point. SI17 resolves exterior or interior dampness and is indicated in the treatment of swelling of the cervical glands and goiter. It also resolves toxic heat in the parotitis, mumps, and tonsillitis. Subdues rebellious chi in breathlessness, wheezing, coughing, vomiting. It resolves dampness in goiter, scrofula of the neck, swelling, and pain of the neck. Expels toxic heat in mumps and tonsillitis. Benefits the ears in tinnitus and deafness. In the spiritual pivot, Jianrong was classified as a point of the gallbladder channel, while in the systematic classic of acupuncture and moxibustion, it was listed as belonging to the Sanjiao channel. It was not until the 10th century classic secret of a frontier official that Jianrong was finally ascribed as the small intestine channel. The point SI17 is discussed in the chapter Needling Methods and the upright and pathogenic chi with the spiritual pivot. According to Chi Bo, the Yellow Emperor's advisor, this point should be needled for great rebellion of yang chi which rises to fill the chest, causing congestion of the chest, agitation and rising of the shoulders, dyspnea and wheezing with inability to sit or lie down. In such an illness, there is aversion to dust and smoke as it causes breathing difficulty as if the throat is blocked. A clear reference to an acute attack of asthma. He compares the speed at which needling this point takes effect to wiping away the dust. SI17 is one of the 10 points listed in chapter 2 of the spiritual pivot that have come to be known as window of heaven point. It already exemplifies the character and action of these points in its ability to regulate rebellious and chaotic inversion of chi. SI17 shares with these points the ability to treat scrofula and goiter due to stagnation of chi and phlegm in the pivotal neck region, as well as throat disorders. Descend rebellious chi in this case of lung and stomach manifesting as fullness of the chest with difficulty in breathing, cough, asthma, wheezing, and vomiting, and three disorders of the sense organ, in this case, the ears, tinnitus, and deafness. From small intestine, 17, chi flows to the face. Heavenly in the name refers to its location in the heavenly part of the body, as well as its nature as window of the sky. When wrong is translated as food, it implies protection. This point can be used to relieve wind disorders. Wind bee and sore throat. Okay. Situated on the posterior edge of the mandible, in the notch of the bone, this is tricky, energetic geography for chi to negotiate, and this point allows the chi to be helped on its way in this important area. Given the effect of the senses of windows of the sky, not only at the physical level, but in the mind and spirit, it is interesting that this point, GB15 regarding the confusion over the initial classification of this point as a window of the sky on the gallbladder. This is the second point on the small intestine to be a window. This may reflect how important and necessary it is for the small intestine to have clarity of consciousness, to discriminate accurately and have the ability to focus given the amount of information it has to separate, and given its role of assisting the heart through purification and filtration. When a person feels depressed, their spirit skewed and dreamy from effort or feels isolated from others. Heavenly appearance can ease the sense of separation with a refreshed, purified perspective and awareness of the connectedness and radiance of life. As a window of the sky can be used alone or in combination with SI16. Wind of the sky points regulate and descend rebellious chi. Asthma, breathing difficulties, chest pain, feeling of fullness in the chest can all be helped by this point. Benefits the neck, throat as a local point. Severe acute tonsillitis, disperses swelling, pain, or difficulty swallowing and speaking, pharyngitis, chills, and fever. Wind of the sky points activate the sense organ, and this point can benefit tinnitus and deafness. Energizes the meridian and eases shoulders, scapula pain, especially where there is inability to raise the arm. Consider using SI16 first, then SI17. Both are used to treat spirit. For mental imprisonment, helps bring about new perspective in person's life, enhances clarity of consciousness, helps with discrimination and focus. For hearing problems such as tinnitus or deafness, also for asthma and breathing problem, as well as shoulder and scapula pain. Thank you for your attention.
We continue with our discussion of influenza A. As for fever, it is important to understand that the Chinese terms fa shao or fara do not necessarily indicate fever. Fever is a sign in modern Western medicine, not in old Chinese medicine. In old China, there were obviously no thermometers, and the old texts do not necessarily mean that the patient has an actual fever. It literally means emitting burning heat, and it indicates that the patient's body objectively feels hot, almost burning to touch. The areas touched were usually the forehead and especially the dorsum of the hands, as opposed to the palms, which tend to reflect more empty heat. So the body is subjectively hot and the patient feels subjectively cold. In fact, it is a characteristic of Fare, so-called fever, in the exterior stage of invasions of wind that the dorsum of the hands feels hot compared to the palms and the upper back feels hot compared to the chest. This subjective hot feeling of the patient's body may or may not be accompanied by an actual fever. When the symptoms of shivers and feeling cold occur simultaneously with the objective sign of the patient's body feeling hot to the touch or having an actual fever, it indicates an acute invasion of external wind, and it denotes that the pathogenic factor is still on the exterior. In particular, it is the symptoms of shivering and feeling cold that indicate that the pathogenic factor is on the exterior. The moment the patient does not feel cold any longer, but feels hot, and if in bed, it throws off the blankets, it means that the pathogenic factor is in the interior and it has turned into heat. The fever or hot feeling of the body in external invasions of wind is due to the struggle between the body's qi or upright qi and the external pathogenic factor. Thus, the strength of the fever or hot feeling of the body reflects intensity of this struggle. This depends on the relative strength of the external pathogenic factor and the strength of the upright qi. The stronger the external pathogenic factor, the higher the fever or hot feeling of the body. Likewise, the stronger the upright qi, the higher the fever or hot feeling of the body. Thus, the fever will be highest when both the external pathogenic factor and the upright qi are strong. Therefore, there are three possible situations: strong pathogenic factor and strong upright qi, high fever or hot feeling of the body. Strong pathogenic factor with weak upright chi or vice versa, medium fever or hot feeling of the body. Weak pathogenic factor and weak upright chi, low fever or hot feeling of the body or no fever. However, the relative strength of the pathogenic factor and the upright chi is only one factor which determines the intensity of the fever or hot feeling of the body. Another factor is simply the constitution of a person. A person with a yang constitution, that is, with predominance of yang, will be more prone to invasions of wind heat rather than wind cold, and will be more prone to have a higher fever or hot feeling of the body. It could be said that the constitution of a person is the main factor which determines whether a person who falls prey to an invasion of wind develops wind cold or wind heat. Were it not so in cold northern countries, nobody should fall prey to invasions of wind heat, and this is not the case. This is also the reason why in children, invasions of wind heat are more prevalent than wind cold. This is because children are naturally young in nature compared to adults. There are, however, also new artificial factors which may predispose a person to invasions of wind heat when succumbing to wind, and these are very dry, centrally heated places, hot working conditions. For example, cooks, metal workers. Thank you for listening.